it's my pleasure tonight to introduce our speaker, and this presenter tonight is Eleah Stringer, and she's a registered dietitian, and she's an oncology dietitian at the BC Cancer Agency, and her topic tonight is nutrition. So she's going to speak to us for around 25 minutes, and she will take some questions. She has a young family, and so needs to leave a bit early. So we'll take that into account so she can get away, but there still will be time for questions. Okay?
Hi everyone. Hi, thank you for having me here tonight. Just being here in the last 20 minutes, I can already feel how powerful this group is, so it really is an honor to be here with you tonight. So as you mentioned, my name's Eleah Stringer. I'm a dietitian with the BC Cancer Agency, as well as with Island Health. And perhaps more importantly, I'm the research assistant to this new project we have going on called the DAPR study. And this is done in association with the Island Prostate Center. And it has graciously been funded by the 2015 West Coast Motorcycle Ride to Live grant. So I feel very honored to have received this grant. So what exactly is this study? So what this study is we are providing detailed prostate-specific nutrition education classes on a weekly basis. This will be going on for a duration of 8 months. And what we are going to be looking at is whether providing these classes are meeting your diet nutrition information needs, whether it's going to be helping or whether we're going to be seeing a change in your attitude, knowledge, and practice from attending these sessions. And we're ultimately hoping to assess how sustainable this is. Right now, these classes will just be going on for the 8 months, like I mentioned, but we're hoping to be able to continue them on long term. So what I'm wanting to do tonight is just chat a little bit about nutrition for prostate cancer, give you a little taste of what nutrition for prostate cancer looks like, and then we'll talk a little bit more about this DAPR study, so the Diet and Prostate Program Evaluation and Recommendations. I will leave some time at the very end for questions. If you have any burning questions, we may be able to address them throughout the presentation, but otherwise we will try and take a few at the end. So this is what we're going to look at tonight. So first, why is nutrition important? Why does this matter? And what have you heard about nutrition? There's so many thoughts and theories and ideas floating out there about nutrition, especially when it comes to cancer. So let's find out a bit about what you've heard so far. And what about nutrition when you're on treatment versus not on treatment? Is this the same? Is this different? So we'll touch on that as well. And then we often hear about dietitians promoting an evidence-based practice. But what is this evidence-based? So we'll review what an evidence-based is and how we apply that to nutrition information. Then we're going to look at a few of the hot topics in nutrition. So working in oncology nutrition, there's 3 questions that I get all the time. So I'm going to make sure we're going to cover those ones tonight. So hopefully you'll walk away with some of these questions answered. And these ones are going to be, does sugar feed cancer? What about a low-carb diet? Does that affect my PSA at all? And lastly, are organic foods better? Then we'll review a bit more about the DAPR study. I'll give you all the details about that and how you can register and sign yourself up. And then we'll save some more time at the end for questions. Does that sound all right? Yeah? Great. All right, so some of the facts. You may have seen these before. So right now, 1 in 8 Canadian men will be diagnosed with prostate cancer. We do also know that between 2001 and 2009, the survival rate went up by 4% per year. And they say this is due to improved testing and treatment options. But what I also wonder is, does diet and lifestyle changes, did that play a role in this? There's so much new momentum and energy around making lifestyle and diet changes, and I have to wonder, is that impacting our survival rate? So that's something that's always in the back of our mind. So why is nutrition important? The first point, maybe it seems a little obvious. It helps you feel your best, right? But nutrition, it goes so much more beyond providing the nutrients to our physical body. I often hear that if you're feeling a little bit dehydrated or you haven't been drinking enough water, people start to feel a little bit depressed. Sometimes they may find they're feeling a bit more anxious, and that can start to spin, and then it starts to affect you emotionally, and that can even affect you spiritually. So nutrition is so much more than just feeding your physical body. It's about the whole person. So our nutrition can really affect our entire well-being. So next, it can also help prevent recurrence. So we're going to touch on this a little bit tonight, but if you come and attend our DAPR study, so attend one of our nutrition modules, we're going to go into this in depth. So you will get all the details on all the steps that we can take to help prevent the recurrence of prostate cancer. Next, nutrition can also help minimize some side effects that can occur from treatment. So it sounds like some of you may be on some treatment, some of you may have treatment in your future, or some may have completed treatment. But there are some side effects that can be common from different types of treatment, and fortunately, we can use nutrition as our tool to help manage some of those side effects. So that's another reason that nutrition is important. It helps us feel better and manage some of those treatment side effects. Next, it can help us plan for a healthy future. Of course, we want to feel good in the here and now, but we also want to plan for down the road. So in the study, you are all welcome. Along with your support person or significant other, you're more welcome to attend as well. So for your support person, there's often little gems that I think you're going to be able to glean from this that has to do with planning for a healthy future. We do know that those with prostate cancer are at a higher risk of some other comorbidities, such as obesity, heart disease, and diabetes. So we're going to go into depth about things that we can do to help manage and prevent these. So I would love to be able to go around the room and hear a little bit about what you guys have experienced with nutrition so far, some of the things that you've heard, but I'm thinking we could end up being here all night. So perhaps what we can do is with a show of hands, a few things are going to pop up on the screen, and if you've heard about these diets, or perhaps you've even tried some of them yourself, with a show of hands, just let me know if this is something that's familiar to you. So, has anyone heard of the acid-based diet? Yeah, we've got a few hands there. And what about drinking lots and lots of green tea? All those antioxidants, right? Yeah, so we've got quite a few hands there. Juicing, making your own juices, right? Has anyone tried that? Yeah, a few. And the raw diet. There are some people that believe that eating only raw fruits and vegetables and even grains can help starve away the cancer cells. Cruciferous vegetables. So what these are, this is our broccoli, kale, cabbage, and bok choy, but especially broccoli. This one's in the media quite a bit, eh? Yeah, I'm seeing lots of green on the broccoli. And eating for your blood type. Has anyone heard of this one? Yeah, we've got a few. Yeah. And the gluten-free diet. This one's quite trendy right now. So we're talking about gluten-free, not when you have celiac disease, but for a preference. There's quite a few hands there. What about miracle shakes? As I talked, or in my practice, as I'm working with some other cancer patients, I'm finding it seems like everybody has an aunt, of a neighbor, of the cousin down the road who has a pill or who has some type of powder you mix with water and it's going to cure your cancer. Does this sound familiar to anyone? Yeah. There's quite a few of them out there. And what about the caveman diet? This is like the paleo diet. Yeah. So we can see, just looking at this screen, there is so much out there. And I know sometimes my head feels a little bit like this screen looks. There's just way too much going on. How do we sort through all of these, right? Are there any other diets out there that you guys have heard of? Or that you've perhaps tried that aren't on this list?
The DASH diet.
The DASH diet, yeah. So that's a lower salt diet, correct? Mm-hmm. Yes.
Pomegranates.
The pomegranates, yeah, that's a good one.
The brat diet when the patient has diarrhea constantly?
Yeah, so when you have stomach problems, some people use the brat diet.
Sorry, what was that diet?
Oh, that is called the brat diet. So it's a list of foods that are easier on your system that some people would choose to try if they're experiencing diarrhea.
the pro and prebiotic diet.
There we go, the pro and prebiotics, yeah. So what I'm hearing here is there is so much information, right? So even if we narrow down to one diet and we decide we're going to research this, we're going to see what science we can find out there for that diet, guess what? The information is still conflicting. So this is an example that I like to pull on for omega-3 oils. So generally, omega-3s are often promoted as being very heart healthy, raising your good cholesterol and lowering your bad cholesterol. So in 2013, they looked at a study, and what they were expecting to find was that prostate cancer patients with the highest blood value of omega-3s, they were expecting to find the lowest incidence of prostate cancer. But in fact, they found the opposite. They found that men who had the highest levels of omega-3 in their blood had a 43% higher risk of developing prostate cancer and a 71% higher chance of developing high-grade prostate cancer. I would like to mention that this was not a proven cause and effect. This was just a relationship that they saw. So everybody, well, we've been telling everyone to take our omega-3s. Now we're causing prostate cancer. So what happened was all kinds of research took place after this finding. So in 2015, they found a new key piece. And what this was they actually determined the exact mechanism by which omega-3s actually inhibit the growth and spread of cancer cells. So there was a piece missing in that initial linkage, and it required all that extra research to get to the root of action of omega-3s on prostate cancer. So now, what are we recommending with omega-3s? We're recommending including cold water fish, which is an excellent source of omega-3s, into your regular diet. So we can just see, I'm using this as an example of there's such conflicting info. So if you were to Google omega-3s, you would probably find info on the 2013 and the 2015. And then what about being on treatment or not on treatment? Is that affecting our diet? So very often the diet recommendations can vary if you're on treatment. We often take extra precautions when we're on treatment with supplements and antioxidants in particular. We may also do a few diet modifications to help with some of the symptom management. Some of the symptoms that are commonly experienced are diarrhea, hot flushes, some nausea, sometimes some dry mouth as well. So the diet modifications that we most commonly recommend are changes in fiber, fluids, spices, and caffeine. So now we have all that information out there, we have conflicting advice, and then we have the treatment versus not treatment. So what do? Luckily, we as dietitians have sorted through all the information for you. And the way we have done this is by applying an evidence base to our practice. So an evidence base is an ongoing process of continually looking at the high quality research in order to guide our practice. So like this picture shows, we are sourcing the information and finding it. We're going to evaluate it and see if this really stands as high quality research. If it does, we're then going to combine it with what we're currently teaching. We'll then share that with colleagues, share it with everyone else who can use the information, and then we start that process all over again. So what we are doing in applying this evidence base is continually going back to the research so that we have the most up-to-date and most accurate information to provide to you. So that's what we did with the omega-3s, for example. It's because we were continually going back, we found out the new news in 2015 that omega-3s actually are good for prostate cancer. So now that we know we're going to be applying that evidence base to our nutrition, let's jump into some of the information here. So does sugar feed cancer? Has this been anyone's question here? Has this ever come across anyone's mind? Yeah, so quite a few. Hey, yeah, so let's spend some time talking about this. So in fact, sugar does fuel every cell in our body. So this is our healthy cells as well as our cancerous cells. Every cell prefers to use sugar as its source of energy. Our brain alone, though, uses 100 to 100 grams of glucose a day. So it is quite a bit. Our brain is often referred to as being a sugar hog, a glucose hog. So these grams, if you're sitting in a resting state like we are right now, that's about 60% of our energy. So about 60% of our sugar is going directly to our brain. And has anyone heard of the term chemo brain before? Does that sound familiar? All right, I'm seeing some yes and no's. So there's a term out there they like to call chemo brain. Some people who undergo chemotherapy can feel a little foggy, just feel a bit more forgetful, just feel not quite themselves. So imagine now if we're depriving our body of those sugars, and your brain's not getting all the sugar that it's needing, and you're experiencing a little bit of chemo brain, we're not in a good state, right? So we're wanting to make sure that our healthy cells are getting the energy and the fuel that they need in order to heal up. So even if we were to take out all of the sugars and all of the carbohydrates from our diet, our body is quite clever. It is still able to create sugar out of protein and out of fat. So it's actually very difficult to rid your body completely of all the sugar. In my practice, I have seen some cancer patients who have gone out of their way to try and cut out every bit of sugar from their diet. I could think of one girl in particular who was not having any grains, any vegetables, and no fruit. And the only bit of sugar she would allow herself to have was one Smartie in the evening. And this woman was so stressed out and so concerned about the amount of sugar that she was having that the stress was causing so much more harm to her body. So what we often see is trying to cut out all the sugar is actually counterproductive. When we have cancer in our body, it's important to maintain our nutrition so that our healthy cells have the energy and have the minerals and the protein that it needs in order to heal itself. So what do we do with this information? Our recommendation is just on the bottom here. So we recommend limiting our high sugar foods, such as pops, or junk foods, cookies, and other sweets, which tend to be high in sugar, but they have very little nutritional value. So it's okay to include some natural sugars, like vegetables, fruits, and grains, but let's just try and limit the sources that are very high in sugar, but aren't really doing our bodies any good. Does that make sense? Yeah? All right, good. Let's move on to the next one. So the low carbohydrate diet. So the question here is, can low carbohydrate diets, such as the Atkins or the South Beach diet, lower PSA levels? So what happened here is around 2000, when the Atkins diet and the South Beach diet became very popular, someone thought, let's see if being on this diet has any impact on PSA levels. And what they started to find was people who were limiting the amount of carbohydrates, their PSA levels were starting to drop at the same time. So once again, all kinds of researchers jumped on this and they wanted to figure out what exactly is going on. So now we have lots of evidence to look at, and in fact, what the evidence is showing is there actually is no difference in PSA with low-carb diets. What the low-carb diets may be doing, though, is helping a little bit with weight loss. And we do know that weight loss can inhibit the growth of prostate cancer cells. So that's where the association could be. So it's possible that eating less refined carbohydrates, such as white products, or our baked goods with white, or some of our other sweets, lowering those may slow prostate cancer progression. So any benefits that we're seeing from a low-carb diet are probably from eating less refined carbs while increasing our plant-based high-fiber foods. So there's no need to stay away from carbohydrates. We're just aiming to get whole grains and fruits and vegetables. Last one, is organic better? Oh, what I should do is do this. All right, let's do a poll here. So, is organic better? If you think organic is a better choice, let's see a raise of hands.
My wife thinks so.
Your wife thinks so? All right. All right, I would say that's about 50-50 from what I saw. All right, so let's take a look here. So is organic better? So there is one study. It's just listed in the bottom right-hand corner here. And what I can do, if anybody wants copies, I will provide copies of the slides to Sean. So if you guys want copies of these slides, you can certainly access them after. But there's this one study that reviewed 237 other studies that asked this exact same question. Is organic food better? And what these studies looked at, they compared the nutrient content of organic versus non-organic fruits. They were comparing apples to apples. And they were also checking the polyphenol content. So they were looking at some of the antioxidant content. They looked at fungal and bacterial contamination in the fruits and vegetables as well, including bacterial resistance to antibiotics. This is such a new thing. They also compared pesticide residue. So they were comparing the foods themselves, but they also looked at the effects within people. So they looked at some of our biomarkers. And some of these biomarkers were our blood. So they were looking to see if there's traces of these pesticides that's on our fruits and vegetables in our bloodstream anywhere. They were checking to see if any of it comes out in our urine or in our feces. So they were tracking to see the impact of any pesticides on our fruits and vegetables. Are they in our body? Are they staying in our body? Are they making their way out? And what they actually found is that with organic foods, there is less pesticide exposure, but overall, there was no difference to our health. Yeah, quite interesting, eh? And what they're finding is the most effective thing you can do to reduce your exposure to the pesticides is actually just washing your fruits and vegetables under running water. And the running water there is the key part. If we're just soaking it in a sink, it's still just soaking in all of those pesticides, right? We're going to lose some, but it's putting it under the running water that really helps get rid of the pesticides. There are some different detergents and soaps and cleaners out there that are marketed specifically for washing your fruits and vegetables. You can use these if you'd like, but the studies are showing that we get just as good of results from just washing them under some running water. So that is the best thing we can do. Yeah, I see a question.
What time scale did they use for effect on health?
For the effect on health, that's a good question. These studies, because it was looking at 237, some are going to be short-term, but there's definitely going to be some longer-term ones. Longer-term, I would say up to probably 20 years is probably the longest in there. We could certainly go back and review the details if you're interested,
Sure.
but I wouldn't think it went much longer than about 20 years. So what we're finding is the best recommendation is to eat a greater amount and variety of fruits and vegetables. We're wanting to eat the rainbow, right? Get a good amount regardless of how they're grown. If you have the option to buy your fruits and vegetables locally, that's always a good choice too. The less far they have to travel, the less exposure they're going to have to other contaminants, to other types of bacterial contamination or dirt or residue. So if you're able to buy local, that's usually the best and healthiest choice for your fruits and vegetables. But the more fruits and vegetables, the better, regardless of whether they're organic, local, or just a conventional one. So that was just a very little bit on nutrition for cancer. So what I would love is, with this DAPR, we're wanting to get as many people participating in these nutrition education sessions as possible. The more numbers we have, the better case we have for continuing and making this a long-term program. Also, it benefits you because we're going to be able to talk about nutrition for prostate cancer at a very detailed, more specific level. So these are some of the topics we're going to be covering in the DAPR program. So first, why is diet important? We reviewed some of that today, but we'll review it a bit further. We're going to go into quite a bit of detail about balanced diet for disease prevention. So we'll look at the macronutrients. So we'll talk about our carbohydrates again. We're going to talk about what ones are better for you, what ones to stay away from, how much should we be having. We're going to talk about proteins. You may have heard a little bit about the effects of meat and cancer and how you cook your meat and cancer. So we're going to talk about all of those. You're going to get some really great tools to walk away from and some good suggestions on how to cook your meats too. Then we'll talk about fats. The good, the bad, and the ugly. There's so many fats out there. Some are good for you, some we really want to stay away from. So we're going to break that down so you'll have a good understanding of fats. And we'll talk about healthy weights. We do know the importance of maintaining a healthy weight with prostate cancer. Then we're going to delve into some of what I like to call the prostate-specific nutrients. So we'll talk about bone health. So those on any androgen deprivation therapy, this can be quite important. So we'll review calcium and vitamin D, the needs there and the recommendations. We're going to look at phytonutrients and antioxidants, specifically soy and fiber. How much fiber should we be having? And lycopene. Can lycopene be helped? Can lycopene help or prevent our cancer from becoming more aggressive? We'll take a look at that. We'll look at dietary supplements, specifically selenium and vitamin E. So these are the things we're going to be covering in our nutrition education sessions, and we're going to have an hour and a half to do so. So instead of me coming up here and talking to you quickly for 20 minutes and fitting in all these little bits, we're going to be able to sit down, discuss things, it will be more interactive, and we will hopefully be able to answer all your questions, and you will leave feeling like you have a very good understanding of what the best diet for prostate cancer is. So, I need more nutrition info. If you're wanting to attend, these education sessions are going to be on a weekly basis. So the column on the left here, you can see that the first and the third of the month is going to be held at the Hillside Senior Center. So this is Aberdeen Hospital, that's just up on Hillside Avenue there, so it is still fairly close to this location. And that one's going to be on Mondays from 11:30 to 1:30. We do have another option. This will be the second and the fourth of the month. This one will be held over at the BC Cancer Agency, so just on the other side of the property here. And this will be on Tuesdays from 1 to 3. So there's 2 different days and 2 different time slots. I do have some info. Oh, yes, question.
Just some quick feedback. Some of us are still working.
Okay, yeah.
This has no use.
We're hoping, we would love if this becomes an ongoing program to be able to do something in the evening, because I do recognize that it is limiting. We do have it going on throughout the summer and into the fall, so maybe if any of it lands on a holidays. All right. Well, we'll see what we can do in trying to get you some of the information, because we don't want to see anybody missing out.
So this is the first and third weeks, not the first and third of the month.
Oh, it is the weeks, you're right, I should have worded that better, that's a bit confusing, isn't it?
Yeah.
The first and third weeks, yes.
Monday.
So I do have some information pamphlets at the back, which I will explain in just a little bit, and it will have this all written down and in a more clear way as well. So you don't need to write down all the details now, you're welcome to, but we will have everything for you at the back. So what exactly does it entail if you decide to come? So we're looking at a 2.5-hour commitment in total. So the first 20 minutes of the session, we're just going to review the consent form so you know exactly what you're involving yourself in. And then there will be a questionnaire. So I'll ask you to fill out the questionnaire. You're welcome to do it with your support person or just completely on your own. It's up to you. And then we'll get into the meat and potatoes. So this will be when we're going to talk about the nutrition for prostate cancer. And we're going to have an hour and a half to do that. This will include some question time as well. And then at the very end, there will be a satisfaction survey, so we would love if everybody could fill it out. It would be very valuable for us. And then before you leave, we're going to give you another copy of that questionnaire, which we're going to ask you to fill it out 2 weeks after attending the session. And then you can either drop that questionnaire off back at the Island Prostate Center, or at the Cancer Agency, or you can mail it back to us, and we will be including some envelopes with the postage prepaid. So whatever method is easier for you to get it back to us. So that's what we're looking for. And if you do attend, there will be some prizes and snacks, of course. What's a nutrition event without some food? And there's also going to be a workbook. And this workbook is meant to really complement what we're going to be talking about in the class. So that way you can go home, and it's going to have some activities that will be suggested in there to help you incorporate what we've discussed into your life at home. There is going to be quite a bit of material discussed throughout the session, but this way you're going to go home, you're going to have that workbook, so you think, I remember she said something about this, but I didn't write it down, and I cannot remember the details. But luckily you're going to have that workbook, so you can flip to it and read it all out. So you'll end up with a really valuable resource by the end of it. So it certainly is worth attending that 2.5 hours. So, how do we get involved? At the very back of the room there's a table set up, and I do have some participant information packages. So if this is something that has piqued your interest and you're thinking you would like to learn a little more about it, please feel free to pick up a package and take it with you. This package explains the research, so it explains what we're trying to do, it explains the purpose. It has the days and the locations and the times of the sessions. It also has some parking information, because I know parking's always a bit of a challenge. So it does have a map with some suggested areas where you can find parking. And then it does include the consent form as well. So the consent form, I believe it's 19 pages long, but it should answer all your questions. So if you have any concerns about any piece of the study, it's all going to be in there. So before you just jump in and you're not really sure what you're getting involved in, you can go through the entire consent form. So you are welcome to take one of those if you would like some more information. I also have a sign-up sheet, so if you know right now that you're going to want to participate, you're welcome to write down your name and your phone number, and then what I will do is give you a phone call, and then I can answer any outstanding questions that you might have about the study, and at that time we can then slot you into an exact session. So that way we can figure out what month works best for you, whether you like the Monday, Tuesdays, etc. So we will try and do our best to work with your schedule as well. So if you have signed up, all you need to do then is just wait for my phone call, and then we'll take the rest from there.
Question?
Yeah, question.
Are these sessions a one-shot deal, or is it, do you have to come back
Yeah,
week after week after week? then?
great question. This one's a one-shot deal.
It's a one-shot deal?
It's a one-shot deal, yep. So you just need to attend that one session.
Okay.
Yeah.
Because from out of town, if I'm after coming back every week, it's not going to happen.
Exactly, yeah. So the question was, is this a one-shot deal, or do we need to come back week after week after week? So this is just a one-shot deal. You just need to show up one day. We tried to design it so for those of you who may be from out of town, it's convenient and easy to pop down, attend your session, and then that's it.
Okay, now I have a second question.
Sure.
It's been bugging me since the beginning of the presentation.
Okay, yeah.
When you first started the presentation, there was an indication that there was an increase of 4%. But 4% of what? 4% of 1,000? 4% of 10,000? 4% of 500?
Yeah, no, that's a good question.
What are we looking at?
Yeah, so when we're looking at that stat there, that 4% is going to be in total. So when we're talking about survivorship, that's going to be encompassing everybody who has prostate cancer.
Okay, so what's the number?
I don't have the exact number. I would certainly have to do some math. If anybody knows the amount of people with prostate cancer right now, we can quickly figure out what 4% is.
Yeah, it's a big number across Canada,
Yeah.
so it's going to be a big number. So 4% is it's a very significant increase and shows the technology. Pardon? One in Medicaid.
Yes, thank you for clarifying.
Is there a determining time that says, yeah, I am a survivor? Is it 5 years, 10? Because that would make that 4% slightly off the wall.
Let's go
You know
back
what I
to
mean?
that.
What I'm saying is that if you survive 1 year,
Right.
you're part of that 4%.
Yeah, that's a good question.
Any ways to measure survivorship, so a number like that doesn't mean much by itself.
That's very true. It is quite just a general, broad stat. That's very true. And to be honest, I don't know the answer to that question. Sean? I pulled this from the Island Prostate website.
I really think it's just a general stat showing the increase in technology and the improvements in treatment. I think it's just a general stat. Either way you look at it, 4% increase is better.
There's no such thing as a general.
Well, I know, but for what she's using it for, it's a good indicator of how good the technology is.
I figured out during that same period of time, it just need about 4% each year, 4% of a greater number as the years pass by, works out to approximately 36%. Prior to that first.
Right. Yeah, the important thing to take from that stat is that the survivorship is improving. Our treatment and our outcomes are getting better. And that's what I'm trying to get in showing that stat.
Or there's more men being diagnosed
That's true that there's more men being
who have
diagnosed.
low-grade cancer.
That's true, there's more men being diagnosed. But again, because it's a percent, we're looking at everyone being diagnosed. So it's still headed in the right direction every single year. Is that making sense? I feel like I'm not explaining this very well.
The technology.
You're going down a rabbit hole.
Yeah, the technology is better. All right.
Sorry, I opened a can of worms.
No, that's okay. Questions are always welcome. And the last thing is I need your help. So I am looking for, or we are looking for 1 to 2 volunteers who may be interested in assisting in some of these sessions. So the time commitment is going to be from April 4th to December 15th. But if you're not able to commit to that entire time and you would just like to do a chunk of that, we would still like to hear from you because perhaps someone else can pick up the other chunk. And it would be attending the session that would be the first and third Monday of every month. And it will be a 4-hour commitment, so from 10 a.m. to 2 p.m. And what you would be helping with is preparing the room for the education sessions, so arranging some of the furniture to make it nice and friendly and welcoming. You'll also be greeting the participants and their supports, helping distribute any printed materials, as well as helping with the room cleanup after. So if you're interested in helping out at all, please talk to Leanne Kopp at the Island Prostate Center. She can provide you more details and liaise between us. Yes?
Where?
This will be at the Hillside Senior Center, so it'll be at the Yakumovich Wellness Room. But if you're interested, again, I'll make sure you have all the details so you know where you're going. Lastly, we've got time for a few questions. So, any questions out there? All right, we've got quite a few. I think first hand, this gentleman here.
2 questions. One, I'm getting 2 shots. One is the Lupron every 90 days. The other one is, I think it's called Eleah,
Okay.
which is every 6 months. If I'm taking the Eleah, which is supposed to slow down the leaching of calcium on my bone system, do I still have to take the supplementary 1,000 milligrams of calcium? And that would be, and when it comes to buying calcium, I haven't got the foggiest notion of what kind to buy, whether it's calcium citrate or calcium carbonate. Can you expound on that?
Yeah, that was a great question. So the question was, if you are getting any type of injection or taking some medications that may be affecting the calcium in your body, particularly helping your bones hang on to your calcium, should you still be supplementing with calcium? And if so, what type of calcium should you take? Some of these questions I am going to defer to the study, and the reason for that is at the study we're going to be looking at the change of knowledge before attending and after. So I don't want to give away too much of the stuff that we're going to be discussing in the sessions. But what I will say is that calcium supplements are generally recommended if you're not able to get enough calcium through the diet. But we don't want too little, we don't want too much. There's kind of a safe area with calcium, and we will explore that a bit more in the nutrition session. So I encourage you to come to that, and we'll definitely talk about that in some more detail. All right, down here.
As far as an omega-3 supplement
Yeah.
goes, where does flaxseed rate
Yeah.
as far as prostate cancer is concerned?
Yeah, that's a great question. So he was just asking about omega-3 oils and how does flaxseed work? So flaxseed is another excellent source of omega-3 oils. It's probably the second best source of omega-3 oils next to our cold water fish. It is considered safe for prostate cancer. We will talk a little bit about flaxseed as well in the DAPR study. So if you attend there, we will be able to touch on that. It is another one where we don't want an extremely high dose of the flaxseed because there are some what they call phytoestrogens that come along with flaxseed. But if you were just supplementing with the omega-3 oils, the omega-3 oil from a flaxseed is perfectly safe. But we can talk about that a bit more too. Yeah, Dan.
Will the DAPR sessions get into food preparation, food storage, like your water bottle? I notice you've got a reusable one as opposed to a disposable one. Will the DAPR study get into the aspects of food storage, food preparation as well?
Yeah, so the question was whether the DAPR study will be exploring aspects of food storage at all. What we will be exploring is some of the cooking methods related to meats, but that's about it. We're not talking too much about, if you're thinking of the chemicals leaking from plastic water bottles, we're not going to be touching on that too much. If it comes up in discussion, I'm happy to facilitate the discussion around it, but that wasn't one of the topic points. So there's going to be a bit of information on healthy cooking techniques, and we'll say that.
Yeah, steaming versus boiling, that sort of thing.
Yeah. Yes.
I've become quite frustrated because I don't really know what to cook anymore for my husband. Because he went from one hormone treatment, which didn't work anymore, and his PSA went up to 30, and his hemoglobin is actually quite low now too. He went to another hormone treatment, what is it, bicalamide, or something to that effect? Yeah. And so he's on that now, and that's obviously affected his whole system. His whole digestion seems to be different, and he has constant diarrhea. So he's lost about 12 pounds. And just being on the brat diet, the banana, the rice, the toast, and cooked apples, he doesn't get any greens.
Right.
And as soon as I try greens, of course, it gets worse.
Right.
So what do I do?
Yeah, so the question was, one of the men here has been experiencing some of the nutrition-related side effects from hormone therapy. Specifically, not very much of an appetite and having some digestion
He has
issues.
appetite,
Oh,
sorry.
have an appetite, okay.
He's taking something else to help the pain,
Oh.
which actually increases appetite, but he's still losing weight.
Okay, so he's experiencing
And
some
he's
weight
tired
loss.
because of the hemoglobin.
That's right. So there's often quite a few factors that we want to consider in finding the right diet for you. And this is where our recommendations, if you're on treatment or not on treatment, can vary. We will talk about the best thing to do for diarrhea in the DAPR study, because that is probably the #1 side effect is diarrhea. And this is probably the #1 side effect also that nutrition can have the biggest impact on. So we do have some very specific recommendations, and I've given them to many, many patients, and they come back and their diarrhea is essentially resolved. So it can be quite effective. So if you're able to attend, I'm happy to go over that information then, and you'll have it all in that booklet too. You'll get all the information to maintain that diet at home in that workbook that we're creating. Another option is if you are you registered with the BC Cancer Agency then? Or working with them? Yeah. So you are welcome to ask to speak to a registered dietitian there, and they may be able to see you on a one-to-one basis, in which case, because you brought up multiple factors like the hemoglobin and losing weight and the diarrhea, it may be beneficial to see them on a one-to-one basis, and they can give you some strategies there.
Thanks.
Yeah, you're welcome. All right, you're back here.
For those who can't make it to the sessions, will the nutrition information that you're going to have there be available in any other format?
Yeah, that's a good question. At this point, the plans were, and please, Sean, correct me if you were thinking differently. I was not thinking the information is going to be available yet, only because it's part of the study, and we're kind of monitoring how much information is out there. Basically, if we're able to demonstrate there is a really strong need for this information, it's going to help in bringing the program and keeping it going.
Also keeping the material available, like if we get good results from the study,
Yes.
is to keep the material going as well, so that we can have it at the prostate center, so say someone comes in for a question, we can have it available.
Yeah.
But until that time, we can't.
Yeah. So hopefully next year then the information will become more public and more available. But at this point, because of some of the logistics with the research, we're having to keep it locked down a little bit.
There might be bootleg copies soon.
Yeah. That's right, hey, that's right, you never know. All right.
Yes, you had a very interesting point there about sugar. And simplified, people say sugar's horrible for you, right? You can't have any sugar.
Right.
And so a dietitian speaking to to the diabetic center about diet, is that similar to this? Or, I mean, if you're dealing with sugar and cancer, what is the balance?
Right. So the question there was, when we're speaking about sugar and cancer, is it going to be similar to a dietitian speaking to a diabetic group about sugar? And there's definitely some overlap in what a dietitian would be teaching diabetics about sugar and what we will be teaching any cancer patient about sugar. And that is that essentially whole grains, whole fruits, and whole vegetables is the healthy source of sugar. Because all of those still break down to sugar in our body. We're just wanting to stay away from the refined types of carbohydrates. Some diabetics, if you're on insulin, for example, you may be getting some different information about carbs because you may need to count the exact grams of carbohydrates that you're having in order to calculate your insulin properly. So there's definitely a few differences, but there's lots of overlap. Yes?
I can't believe that you've highlighted the diarrhea. I have suffered for 7 months nearly since the radiation.
Yes.
I would say there's not 2-3 days a week that I don't technically vacate myself. Doesn't matter whether I'm driving, doesn't matter if I'm walking, and it's all since I've had the radiation. I don't get 5 seconds advance notice. It just goes through me.
So you get that urgency as well.
Oh boy. So I'm really interested about this study.
Yeah, I'm glad you landed here. So what he was just saying is since going through radiation therapy, he's had some really bad diarrhea that has lasted for about 7 months.
Yeah, I had it when I was having radiation, but since I've finished radiation, it's sort of elapsed a little bit, but it's still there.
Yeah, it's still there.
You know, even driving down for the radiation sessions sometimes, bingo.
Absolutely, absolutely. And so he was expressing there's quite a high sense of urgency that goes along with his diarrhea as well. And I hear this quite frequently. Radiation especially, because the prostate is located so close to our colon, so close to our digestive system, though the radiation is targeting the prostate, some of our healthy colon cells that are surrounding it do get affected a little bit as well. So as they're irritated, they're not able to function like they normally would in absorbing all of that water. And as a result, we tend to experience diarrhea. So there are definitely some dietary strategies to help control that because radiation-induced diarrhea acts so differently than just regular diarrhea. So very often, doctors will prescribe psyllium, for example, for diarrhea. But in radiation-induced diarrhea, that's not a good option. So radiation diarrhea is very different than typical diarrhea. So we'll talk to that in the study.
Yeah, thank you.
Yeah, thank you. All right, see a few hands. We'll go to the back of the room.
Fluids, amounts, milk, coffee, alcohol, water, milk, juice,
All right.
syrup.
Absolutely. So we've got a question about fluids. What kind of fluids is best?
Minimum as well.
Minimum as well. So the minimum does vary from person to person, and it depends on what's going on in your system. So for example, if you have diarrhea, we're recommending larger amounts of water because you're losing so much in the toilet. If you are someone who drinks a lot of alcohol or drinks a lot of coffee, we may recommend a little bit more fluid as well. A general guideline, I would say a minimum of 8 cups of fluid a day. And when we're talking about fluid, we're talking about anything that's liquid in our mouth. So this can be milk, water, juice, soup counts as a fluid. Ice cream, because it melts, will count as a fluid. The 2 things that do not count as fluids is going to be alcohol and coffee, 3 things, and black tea. And that's because of either the alcohol content or the caffeine. Whatever we're taking in, we're just peeing that right back out. But any other liquid counts towards those 8 cups. That's our general guideline. Again, it can vary from person to person still, but that is the general guideline.
Is not milk hazardous for cancer?
Yeah, that's a good question. And we will talk a bit about that in DAPR as well. There's definitely some varying opinions on the role of dairy in cancer, so we will touch on that then. Absolutely, thank you. Yeah, one more question here.
Wasn't that 8 cups a day thing completely discredited a few years ago by the guy from Dalhousie?
What thing, sorry?
The 8 cups a day?
The 8 cups a day?
Wasn't that completely discredited?
In many ways it was. Yes, there was a big study, and